I'm extremely grateful to Preeti, Shubhendu, and his wonderful team for giving me an opportunity to interact with you today. I'm a great admirer of actuaries because I believe they are geniuses with numbers, and I have a serious problem with numbers. Thanks to Himanshu, my actuary, I'm learning. I'm gradually getting better at it. I'm a heart surgeon by profession, but I have a very interesting job. My job is putting price tag on human life. Now you must be wondering what kind of a job I am in. Every day I see about 60 to 80 heart patients in my clinic, and good number of them are children sitting on the mother's lap. I examine the kid and I tell the mother that your baby has a hole in the heart and she requires an open heart surgery. She has only one question. Can you guess what that question is? It is never about the scar or the risk. It's only one question: how much it is going to cost. If I tell her that it is going to cost 3 lakh rupees, which she doesn't have, that is the price tag on a kid's life. She comes up with 3 lakh rupees, she can save the child. If she doesn't have 3 lakh rupees, she is going to lose the child. This is what I do from morning till evening, putting price tag on human life. This is what most doctors do across the world from morning till evening, putting price tag on human life. Is there a hope? There is a hope. We believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare children or the patients will receive. And you may be thinking that, okay, it might happen, it may happen, but it's going to take 50 or 100 years. This is going to happen within the next 5 to 7 years. Why I am so bullish that India will change the way healthcare is delivered is based on some fundamental shifts what are happening in India today. Few years ago, we had shortage of doctors. It took successive governments 60 years to add 55,000 medical seats to train MBBS doctors. Our current government, in just 10 years, added 75,000 medical seats. And during the last Republic Day, our Prime Minister made an announcement that we are going to add 75,000 additional medical seats in the next 5 years. Believe me, there is no single country in the world which can do that. Now, why do we have to do it? This is because when India trains medical manpower, we cannot look at our need. We have to look at the global need. Because an American doctor will never work in England. An English doctor will never work in America. But an Indian doctor is happy working anywhere. So when we build manpower, we need to look at the global requirement. And today, at least the major cities have adequate number of doctors. Before COVID, we had acute shortage of beds. Thanks to private equity investments, today we have, at least in the big cities, adequate number of hospital beds. For your information, city like Bangalore has more beds than most of the cities in Europe. But there is a problem. The problem is occupancy of the beds in US and Europe is in the range of 80 to 85%. And unfortunately, the occupancy of beds in India is in the range of 60 to 63%. That means we already have built-in capacity to double the number of patients we treat, but that is not happening. Why? The other interesting data I want to present you, that in the last 5 years, no hospital in the country has increased the number of patients they are treating. No hospital has increased the number of procedures they are doing. But every year, cost of healthcare keeps going up. Today, the cost of healthcare is beyond the means of more than 70% of the people. And that is the problem. Today, beds are not the problem. The problem is 70% of the people living in this country cannot admit their loved ones to any of the private hospitals simply because they do not have that money. They are not poor. They may have a little house they live in. They may have a patch of land, ancestral property, but they don't have the liquidity. Today, to admit a patient to any private hospital, you need to have at least 2 or 3 lakh rupees in hand, which they don't have. And that can only be addressed if we have a way to pay for the health insurance 3,000 rupees premium, which should cover them up to 3 lakh rupees as a EMI. This is the foundation on which the future of Indian healthcare will hinge. So the need for the country to take healthcare to the next level, there is a desperate need for an affordable health insurance. I insist, affordable health insurance. There are insurance companies. Why that gap still exists? That gap still exists because of the trust deficit. Today, in delivering healthcare, there are 3 important stakeholders. First one is the health insurance company, second one is the hospital, and the third one is the patient. Health insurance companies do not trust the hospitals. Hospitals do not trust the health insurance companies. And the patient doesn't trust both parties, and those 2 parties don't trust the patient. So we have a situation wherein there are 3 important stakeholders in healthcare delivery who do not trust each other. When the 3 important stakeholders don't trust each other, that business can never be scaled up. And this is the problem why hospitals are stuck with the numbers and health insurance companies are stuck with the numbers. Now, how do you change? Around 1.5 years ago, I happened to visit IRDA for some meeting, and the IRDA regulatory authorities asked me why I didn't apply for a health insurance license. And I thought insurance was only for big companies. And they offered me the license. They committed that if I apply for a license, in 4 months they will give me the license. And believe me, we applied for the license. We became the first hospital group in India to own a health insurance company. Now, hospital becoming a health insurance company, why it will make a difference to the patients? Today, when I tell a patient that you need a bypass grafting operation, first thing what goes to the patient's mind is it really required, or this man wants to make some money out of me? Whereas when I become a health insurance company, when I tell the patient that you need a bypass grafting, they will gladly agree because I'm going to pay for the surgery, and there is no conflict between me and the customer. When that happens, magic will happen. Secondly, about 16% of the heart surgery done across the country is done by our group. Technically, more people develop heart attack, it is better for my business. I have no incentive today in preventing people from developing heart attack or any disease. But when I become a health insurance company, I will work very, very hard to make sure that people don't fall sick. And that is the only way I can save money. And this will definitely resolve the conflict between the customer and the provider of the service. I would like to talk to you about the health savings account. I'm not sure how many of you are aware about health savings account. This was started in Singapore in 1982 or 84, became very popular. Very popular in China. There are 300 million workers who are covered by health savings account. It's very popular in the US. Now, what is health savings account? I'll simply explain to you. Good number of you have some domestic help, some maids working in your house. Whenever they do some extraordinary work, exceptional work, we tip them. We tip them to their UPA account. During the festival, we tip them. What do they do with the money? They just waste it away. Now, if they have a health savings account, you, instead of tipping her UPA account, you tip the money into her health savings account, which is a zero balance account. And that money can be utilized only for paying for the premium of health insurance. So over a period of 1 year, she will have enough money to pay the premium. Now, this is a health savings account. Why it is important? Because if you ask your maid that, look, I'm going to give you 3,500 rupees, and with that money, you buy the health insurance, that will cover you up to 3 lakh rupees. She will tell you, boss, you give me 3,500 rupees, I don't want insurance. But here, you transfer the money to her health savings account. She can only buy the health insurance with that money. Now, this is a regulatory body, the regulatory product, and obviously you have to apply to the regulatory authorities. This is what we did. I just want to ask you, you're all dealing with regulatory bodies, to get something called health savings account, which many people, including people who are running health insurance company, don't know how long it will take. 2 years, 3 years. It took us just 3 months to convince Reserve Bank of India about health savings account. On 18th of December, Bank of Baroda became the first bank in India to roll out health savings account. And this is new India where magic happens. Now, 50 years from now, when people, some historians, want to write the history of Indian healthcare, there will be 2 chapters. One chapter before December 18th, before health savings account happened. One is after health savings account happened. I'll explain to you why. First thing, a health insurance company, the health insurance premium should be affordable. And secondly, the customer should be able to pay the premium as a EMI. Because 3,500 rupees may not be a lot of money, but once you convert into EMI as 10 rupees per day, which is price of 1 cup of coffee, which will cover the person for 3 lakh rupees, it's a very attractive proposition. Then, as health insurance professionals, you would have seen many companies offered premium in EMI, but that failed. Why that failed? That failed because of 2 things. One is, India is the only country where health insurance is sold with annual payment once in bulk. And India is the only country in the world where health insurance means hospitalization expense, whereas all over the world, health insurance means primary care, secondary, and tertiary care. When you are paying the customer's hospitalization, only 5% or 7% of the people will experience what insurance is. After paying premium for 2 years, 3 years, they get nothing in return, then they'll stop paying the premium. Whereas if you offer primary care, 60% of your members will avail what health insurance is, they'll continue to pay. And this is exactly what we want to do. We want to offer primary care 24/7. We want to offer them clinic visits as many as they want, of course at a discounted price. So once customers experience the holistic experience of primary care, secondary, and tertiary, believe me, they will pay the monthly premium. So our strategy is 3,500 rupees per year approximately should cover the person for about 3 lakh rupees. Now, you may be wondering, how is it possible to cover with just 3,500 rupees, 3 lakh rupees? I just want to give you our experience. 22 years ago, in the state of Karnataka, there was drought for consecutive 2 years. Our farmers lost the capacity to buy health care. And my friends who are running hospitals across Karnataka state were grumbling that there are no patients to operate, OT is empty. One day I called all of them, we had a meeting, and we decided to launch an insurance for the farmers only for surgeries. And the insurance called Yashaswini was born 22 years ago. And fortunately, Karnataka state government adopted the insurance and they agreed to become reinsurer. And the premium was 5 rupees per person per month. 5 rupees was the price of BD they smoke every day. We told the farmers that one day you don't smoke, give the money for the insurance. We had 4.5 million farmers paying 5 rupees per month. And we networked with 600 hospitals across the state. And we ran the insurance for 12 years. In that period, 1.2 million farmers had varieties of surgeries and 130,000 farmers had cardiac procedures. All this happened with just 5 rupees per month. This is the beauty of India with 1.4 billion people. We can do amazing things. We run hospitals in Cayman Island, which is one of the richest countries. We run hospitals in England, which is again a very rich country. And I get astonished to see good number of people living in those rich countries do not have data in their mobile phone. It is too expensive. Whereas in my country, even the beggars watch Netflix in their phone. Why this happens? Because we are 1.4 billion people. This is what we can do, which no other country can do. Now, I just want to end my talk with what inspired us to become a health insurance company. I left England in 1989, 36 years ago. And the first 20 years, very few people had the money to undergo heart operation. The first heart surgery I did 36 years ago, the first patient paid 150,000 rupees. And today, we are doing more or less for the same amount of money, heart surgery. Tell me, what was 1.5 lakh 36 years ago? The same thing, you can buy anything with that price. It is not possible. But we realize that it doesn't matter. You reduce the cost to even 50,000 rupees. Majority of Indians still can't afford it. Something interesting has happened in this country in the last 10 years. I started my talk with the tragic story of how we put the price tag on human life. Today, when I tell the mother that your baby requires a heart operation, it costs 3 lakh rupees. She will cry, she will beg, she will touch our feet, and it's a very humiliating experience we go through. But before she leaves my office, she will invariably turn around and tell me that, Ami 1 lakh dete pari. I can give you 1 lakh rupees. That made us to think, this lady coming from virtually a slum from eastern India, today arranged 1 lakh rupees to save her child's life. She doesn't have 1 lakh rupees. She would have borrowed, she would have sold what she has, she would have done many, many things so that she can save 1 lakh rupees. Just imagine if we have a health insurance with a premium of 10,000 rupees per year. This lady today has enough money to pay the premium for the next 10 years. She already has enough money to pay the premium for the 10 years to protect her entire family. But she can't create that insurance. We can. This is the power of what we can do today in this country. So, just to reassure you that whatever I'm talking about is not a dream, it is going to happen. I'll give you one simple data to understand how healthcare in this country runs, how it will change the future, not only of India, it will change the way healthcare is delivered across the world. I will give you simple data. Let's look at the commonest operation done on human being called cataract surgery. And look at 3 countries. Look at US, China, and India. US does 3.5 million cataract surgeries a year. China is 4 to 5 times bigger than US. They do everything in large scale, grand scale. They should be doing 4 to 5 times more than US. They do 3.2 million cataract surgeries a year. That means majority of the old blind people in China, because of the cataract, they cannot see, and they wouldn't have heard about somebody who had an operation. Why? Because in China, healthcare is controlled and delivered by the government, whereas in India, the entrepreneurship is driving the healthcare. Now let's come to India. How many cataract surgeries in India we are doing? US does 3.5 million, China is doing 3.2 million, India does 8.5 million cataract surgeries a year. India does more cataract surgery than US, China, and most of the European countries put together. How India is able to do it? India is able to do it because 35 years ago, ophthalmologists got fed up of big Indian hospitals. They said these hospitals are too expensive for our patients. They walked out of the hospital, they went to communities, created rented houses, created a small OT and a clinic for themselves, and they lived in the first floor of the same building, and they reduced the cost of cataract surgery to a level that anybody could afford it. And they changed how the cataract surgery is done. And today in India, nobody is blind because of the cataract. And this is what India does. So I just want to end my talk saying that I have a dream. I have a dream that when anyone falls sick in Indian families, the discussion should be about how to get the best care, but not about how to find the money. I have a dream that no hospital in India will ever need to have a cash counter. There will be a health insurance company which will manage seamlessly everyone's health care. And my last dream is to live, I want to be alive for this dream to become a reality. Thank you.